A note for the people watching at home, if we don't cover the question that you have, please contact Steve via email or calling. He'll be glad to answer it, right, Steve?
Yes, no problem.
All right. So are we opening it up for question and answer?
I want to I don't know, I've got a few more things which we'll get into home health care and kind of slide into that too. So, anybody have any earth-shattering questions? Yes.
Okay, I read that if you do not take Part B when you turn 65, there's a penalty every year for not taking it. Is that true?
Okay, if you do not take your Part B and you have no other coverage, now if you have coverage through an employer, you don't have to take your Part B. And again, that's where I want you to talk to your human resource person at your employer. But if you just say, I'm not going to take that Part B, I have no other insurance, I'm just going to have A and a drug plan, when you do go to get your Part B, yes, there's a penalty, and normally you got to apply sometime in December or January, and it won't kick in until July. And it's about a 10% penalty forever. While we're on the penalty mode, drug plans. And most Advantage plans have a drug plan in them. A separate drug plan, you say, I'm not taking any drugs, or heck, I can get them at Wally World for $3 or $4. I don't need a drug plan. Why do I need a drug plan? Well, when they created this Advantage plans and drug plans in 2005, 2006, what that did, now for every month that you are eligible for a drug plan, that you do not have a drug plan, you pay a 1% penalty per month. So if you go 2 years without a drug plan when you were eligible for a drug plan, now again, if it's in an Advantage plan, then it's no problem. You have it. Or if there's any vets in the room, if you're getting your drugs through the VA, that's a qualified drug plan. You're not going to pay any penalty. But if you go 2 years without a drug plan, you're going to pay a 24%. So based on the median drug plan, which is around $30, so you would pay a penalty of around $7.20 every month, moving forever. So even if right now the most economical drug plan is about $17.10 with Aetna. There's another company called WellCare that's out there for $15. They're fairly new. I didn't jump on the bandwagon. I don't like new companies. Let somebody else do all the dirty work. And I share my office with some other agents, and they jumped on it, and they're having issues. Anyway, bottom line is, you need to have a drug plan when it's eligible. So, and as long as your work has a viable drug plan. Sometimes some of the drug plans at employers are not up to snuff on drug plans. I cannot answer that. That's where it comes to your talking to your human resource person. David?
Greg is going to be running the mic around, so wait till he gets to you. If you have a question, hold your hand up. Greg will bring it to you. Also, I should have mentioned, whoever has a question, say your name first. That was Vanessa Scott. And even though we won't see you on video, there will be people that know us.
Vanessa was here, man.
Yeah. All right. Anybody else right now? I have a question for you.
Yes, sir.
And I don't know if it's on my mind because I'm a cheapskate.
Yeah.
Why Steve Holtz? Can we do all this ourselves and avoid paying commissions and save money?
It doesn't cost you any more to use me. I get paid by the commission from the insurance company. If you go on, for example, to Humana and sign up yourself, you're more than welcome to do that. But the biggest thing I bring to the table, if you have that issue, if you have that things where you're dialing, you can't get through, you're dialing that toll-free number, that's why you have me. Your premium is no different whether you bought it yourself or with me, but you have me to be your advocate. You have me to call up, bang your shoe on the table and say, this is going on, what's going on, let's find the root cause. A lot of times I just need to take that information, talk to the insurance company. I might have to come back and do a three-way call with you or get a copy of whatever the doctor coded wrong and get the doctor involved. I mean, I have had one lady she was in Gary, Indiana. The doctor wouldn't give her her medical records. Didn't owe him a nickel, didn't have to do anything. She called me just complaining. After a couple calls, I said, no problem. I'll see you at 10 o'clock. I called up the Gary police, went there. We went to the doctor's office. We left with her medical records. I took a cop with me. I mean, they're your medical records. If you don't owe that doctor a nickel, he needs to give you your medical records. If you're moving to Florida, you're moving whatever, you want to take your records, I don't put up with crap. I mean, it's common sense is what everything is. So that's where you get me. And you get my company, Health Markets. We're the largest insurance agency in the United States. We're the #1 distributor. You name the company, we sell more than any other company out there. So if push comes to shove, I mean, Ken Vazzola is our CEO. He's been with United Healthcare and Humana. Once I called him up and he's made one call for me, I got taken care of. I didn't have to do anything. So you got the strength of our company and you have me as your advocate. Because how frustrating is it to be on the phone and sit there and hold, right? So I do that for you.
What happens when you retire?
When I retire? Okay, what's going to happen when I retire? One, I'm 65, I like what I do. I can see probably 4 or 5 years down the road, I'm going to hire a young lady to kind of handle, or a man, I don't want to kind of handle my day-to-day stuff. But as long as my marbles keep working, you're my annuity, man. You're my income. As long as, like I said, every year I got to pass that certification and such. And if it comes to the point where I'm done, I'll turn it over. We got some really, out of our office, our little office, Elkhart, Indiana, I think there's roughly 34 agents that work out of there. We've been the #1 Medicare agency in Health Markets ever since we've had Medicare. And believe me, the CEO always says, yeah, those little Hanyackers in Elkhart, they're kicking Chicago's ass or taking care of New York. So I'm going to do it. I might, like I said, I'm February. Happy birthday to me. I'm gone, man. I'm toast. I'm going to Florida. But yet, I'm telling everybody, I still have my cell phone, still have my laptop. I'm going to leave a message. Call your customer service on the back of your card. You don't like what you hear, give me a call and I'll return it whenever. I'm always on the clock.
Did you talk about the training that you have to?
Well, yeah, I earlier, every company that I represent, especially for drug plans and advantage plans, it's 4 to 5 hours every year for each company. So I spend 40, 50 hours and it's a lot of it's redundant. I make it sound like it's earth-shattering. It's just a pain, is really what it is. But you got to pass the test. You got 3 times to pass the test. And then every 2 years for my license, I got to go through continuing education for that, for Indiana, and then that's good for Illinois, Ohio, and Michigan.
So I broke my own rule. My name's Dave Miller with a cold, sorry. So let's say there are a lot of us in our class 72, that have already turned 65, but there's a bunch of us that are still hanging on to 64.
Right.
Before we get together with you, is there anything we should do? Should we go to Medicare?
Well, that's where I was going next. Okay. When do I sign up? What do I sign up? What should I need to do? Okay. If you are drawing Social Security right now at under the age of 62, do you start drawing your Social Security? They'll automatically send you your Medicare card about 3 months before you turn 65. If you are going to draw your Social Security, I really tell people, deal with it, go to the Social Security office, do it through the office, get things set up. If you're not going to draw your Social Security, but you're going to be on Medicare at 65, okay, I turned 65 in November, so August 1st, I went to Medicare.gov. It's really easy. It says, do you want to sign up for Medicare? Clicked on that. It just follow the bouncing ball. It'll ask you the question, are you going to draw your Social Security? No. And it just continues on. After I was done with that, then I set up an account with socialsecurityadministration.gov, SSA.gov. You want to set up an account with them, username and password. It's a real easy, I will say this is one of the things the government did pretty good. It's real easy to see, hey, how much am I going to get if I wait till I'm 66, if I wait till I'm 67? So it's good to have that account set up with Medicare.gov as well as with socialsecurityadministration.gov, SSA.gov. Now if you are not going to draw your Social Security, you want Medicare, you get signed up for B, you should do it about 3 months before. You can do it 3 months before. You don't need to go to the Social Security office. In about 10 to 12 days, I was able to go to the SSA.gov website, find the letter that had my new Medicare ID number, because everybody knows now, it's not your Social Security with an A or a B on, or whatever on the end of it. It's a whole new number. So once I printed that letter, then I have the ability to help you. Once we know when your A is starting, which is always the month of your birthday, and your B. Now, if you are still working and continuing to work and have insurance through your company, that's where you need to talk to your human resource person and see how exactly it works. Now, I know there's a lot of small companies underneath here. If you're under 20 employees, Medicare will be your primary. Over 20 employees, your employee insurance. So if you're in a smaller company, it's very critical to talk to them and see how they handle when you're aging into 65. Once, let's say 2 years down the road, okay, I'm going to start drawing myself. Okay, I like myself. Let's go back to where I'm not drawing my Social Security. So initially, I had to pay 3 months of Part B. Okay, last year it was $134, so I wrote them a check. They sent me a bill. I wrote them a check for $402. They sent me a form that I could have it automatically starting in February to come out of my personal checking account. If you're drawing Social Security, they're snatching it. They're taking that Part B right now before you even get an opportunity to even look at it. They're going to take that Part B out of your account once you turn 65 if you're already on Social Security or Social Security disability. Now, anybody under the age of 65, that's, it's pretty much not this room, but if you know anybody that's under the age of 60 that are on Medicare disability, and it usually takes 2 years, then they'll get their Medicare A and B card. The only product that I can help them with is Advantage plans. You cannot get a supplement until you hit the age of 65. Medigap or supplement until you hit the age of 65. So if you know anybody that's 44 years old and got just Part A and B, and and maybe they might have got signed up for a drug plan. Again, that's at open enrollment, October 15th to December 7th, when you're seeing all that advertising that's out there. When it comes to what's not covered under Medicare, no matter what you do, home health care, right there. There's a lot of, I do this caregiver program at the Goshen Hospital every year. There's a lot of sources out there for people, but I do have products that can help pay it. Now again, if 2 of the ADLs, which are the things to live by, the 6 things you need to be a living individual, if 2 of those are already gone for you, I probably can't help you. I probably can't put a product in to help pay for that home health care services. Long-term care, I do have products. It's called recovery care, where I can cover probably about 1.5 years of long-term care. Combine it with some home care, I can probably cover about 2.5, 3 years of what's necessary. Any veterans in the room or spouses of veterans, my mom was fortunate enough when she was in her skilled nursing facility, we were getting about $1,150 a month from the VA. thank God I have older brothers and sisters that were able to figure this whole thing out, man, because it can get a little bit going. But there are a lot of programs out there to help seniors on what is out there. My niche is really the insurance end of it. I know enough to be scary. It's always good to have a power of attorney, get that going, so somebody can speak for you. Most of the insurance companies that I represent, they have a form that at least your spouse or daughter or whatever can speak to the insurance company on your behalf. When my mom had her issue, I had brothers and sisters coming in. I just kept giving them a form. We sent it in to Humana, and that way they could talk to Humana on behalf of my mom. So again, anything you can think of people-wise, I can help you. Yes?
Donna Johnson. I am on my husband's Social Security benefits because I'm a widow. Does that affect any of this?
Okay. Have you got your Part B? Are you aging when you turn 65?
I will turn 65 in June.
In
So
June?
I haven't done anything.
Okay. Since you're drawing a benefit from the Social Security, I would say probably in March or April, you'll get a Medicare card. And you should get a Medicare card, should automatically come to you, since you're already drawing benefits from Social Security. But again, I'm always one to preference that's what's supposed to happen. It is the government. Right now we're shut down, so I don't know how that's affecting things. But it never hurts. You know, even though I knew what I was doing, I hung out hour and a half down there in line at the Social Security office just to kind of make sure all my ducks are in a row and stuff. And I handed out about 6 or 7 business cards, got a little business out of the deal. But it never hurts. And, you know, to call Social Security, just reconfirm, make sure. I mean, that's what's supposed to happen. You should, in April and May, they should send you a card. You do, I want it, yes. Make sure you know where you put your card. I mean, I had one lady on me, oh, I got my card. We end up finding it in a recycling bin. So it'll come in an envelope about this big from CMS, Center for Medicare Services. It'll come in a half off, you know, an envelope like that, and it'll tell you if you don't want it, send it back. Well, that's where you need to know what's going on with your personal life in regards to an employer insurance or one thing with vets. I've dealt with a lot of vets that were getting false information. Oh yeah, you don't need that B. Well, if you're getting all your services through the VA, wonderful. But I tell them you're better off getting your B, because I've had many a vet come up to me and they want some services that the VA is just not capable to do. And I had to tell them there's going to be a penalty, this is what it's going to cost you, and they just couldn't afford it then at that time. So for the vets, I will say the VA has done a lot of good stuff. I do have quite a few vets that have their B. I have a program through Humana that costs $0, but it just gives them the ability to go to local doctors rather than always depending upon the VA, if they want to have a second opinion or things like that. So keep that in mind.
Hey, Steve. As long as that slides up, I need a new hip and I need a new knee.
Okay.
Should I wait 3 months and do it under Medicare?
Oh, heck yeah. And I would tell you right now, we'll probably put you on a supplement. Anybody has a lot of issues, man, right out of the chute, do a supplement. You know what your fixed cost is. You go to the hospital, you pay nothing. You have a $185 deductible of going to the doctor. Once you pay that, you're done. So go get everything done. Maybe the cost is, you know, about $100 more a month than an Advantage plan. But with an Advantage plan, then you're going to have some co-pays, you're going to have this, you're going to have that. So if you have a lot of issues to deal with, really the supplements, my opinion, is the way to go. But again, you know your budget. That's where I have to sit down with you, listen to you, look at what prescriptions you're taking, talk to you about where you're at financially, and help you get a program that fits best for you.
For the sake of the people that are here, Do you have your calendar with you? Do you have time to book appointments?
Yes, that's why I'm here.
Very good.
I don't get, I do this for free, but I get paid commissions, okay? I'm a straight commission guy, and I'm pretty straight up. When I had good rapport with somebody I just recently signed up, most people I deal with, they don't know me from Adam, but they've either, I've been doing a lot through Google, but really the bulk what I do is referrals now. I'll ask them, I said, only one more question to go. When are you gonna die? They look at me, I said, well, yeah, I make $12 to $15 a month off you, man, I gotta replace you. You know? I get the same response. I haven't anybody throw me out yet, but any other questions or
But
anything?
again, just to reiterate, it costs us no more to have you.
No?
Rick Sigmund. I'm 66. I'm currently still working sole company's insurance plan. Plan on retiring in first part of June. How soon? Don't have Medicare Part B, of course, because I opted not to do that.
Mm-hmm.
How soon should I get a supplement or an advantage plan so I have make sure my insurance doesn't have a lapse?
Okay, so you're thinking about June. I would say February or March. You need to get your Part B back.
Okay.
That's going to be step one. And for people, I find the easiest thing for people to do to get their B back, who gave it back or didn't take it at the time of 65, go to the Social Security office. Doing it online, I've had too many issues with people. Go to the Social Security office. Are you going to start drawing your Social Security at that time too?
I'm drawing my Social Security now.
Oh, you're drawing it now?
Yeah.
I would go into them, hey, I want to get my B started. Okay. And I want it to start June the 1st. It'll always be the 1st of the month, okay? It'll never be the 15th, even though you're working till the 15th. It'll always start the 1st of the month. And then you have, when your B starts, you have, you'll usually know a couple months. You have 3 months before your B, the month of B, and 2 months after to make a choice.
Yeah, well, I'm saying that I don't want any lapse at all.
Yeah, you don't want any lapse at all.
In May. I
So-
can have a supplement start in May, so.
No, it'll start June 1.
Okay.
If you don't need it, I mean, if June 1 is your date, then it'll start in June 1. As long as we meet by May 31st and you got your B in place, it'll start June 1, but just don't call me up and say, where's my card? Okay? So, you're planning ahead, that's perfect. Get your B, contact them. Hey, I'm planning on retiring June 1. I want my B to start June 1. Normally, by sometime in April or May, you should be able to at least get the letter that shows your B is starting June 1, and then we can do something in April or May, and that way it'll just be a smooth transition for you.
Okay, thank you.
You're welcome.
Monica Pletcher. My company has an HSA. Does that play into anything?
Okay, good question.
Because right now I'm paying all my medical bills out of pocket and just socking all the money away into the HSA.
Okay, HSAs. That's a wonderful question. I am under 65 world, I'm a proponent of HSAs. Health savings. Once you turn 65, you cannot contribute anymore to your HSA. You don't lose the money. You can use that money to pay your medical. And I've heard this many a times, but I always tell people to verify. I think you can even pay your premium out of your HSA account for Medicare.
I was just recently told at work that once you're 65, you can use that money for anything.
Yeah, there you
Doesn't
go.
have to be just medical.
Okay, all right. You can go to, HSA.gov and they'll tell you all the inner outers of health savings. But again, you don't lose the money, Monica. It's still your money. You can use it for medical. And like if Dave said you can use it for anything, already on, Wayne.
Also, you mentioned prescription plans. Say right now I'm only on one little prescription a month, and you put me on the plan that suits me best. What if something happens and they put me on a $200 one?
Okay, all right, good
Does
question.
that go up?
Okay, what happens is this. Okay, here we are. Her plan started January 1. Come July, they got her on some Wowie Zowie drug. Okay, we can't change the drug plan she's on, until October 1st with the or October 15th with the January 1st start date. What can we do? Okay. One, samples from doctors. Write the pharmaceutical company. GoodRx.com. That's really the three things that I've been able to do for clients who have experienced that. They just don't, there's a certain enrollment period for drug plans. We can't change the date on that. So that's where, again, GoodRx.com, write the farmers, it's a tax write-off for pharmaceutical companies. I got a lot of people that are on, I don't know, $300 or $400 inhalers that came out of left field, and the plan they're on just isn't the right one for it. So they're getting a coupon and spending $20 for their inhaler and stuff. Because they'll get something from most pharmaceutical companies. You know, put a little few tiers on the letter, and you can usually get some assistance that way. Very good question, Monica. Supplements. If you want to go from one supplement to another supplement, you can, as long as you can pass the underwriting. And that can be done at any time. Advantage plans and drug plans, once you're in until October 15th to December 7th. That's when you can make a move. Now, they just introduced a new open enrollment. If you're already on an Advantage plan with a drug plan, whether it be an HMO or a PPO, and you want to go to a different one, you now can do that from January 1st to March 31st. Question? Sorry.
Repeat the question.
Okay. Basically, she's a widow. Appreciate your husband's service. And she's on there's various programs through the VA. One is called CHAMP, where it's a wonderful plan. I would recommend do your A and B because, again, it's a government program. Hopefully I've been seeing benefits are getting better for vets. But yeah, the CHAMP, I wouldn't touch that with a 10-foot pole. It's a wonderful program. Because you have the ability to go to any doctor right now anyways, correct?
Well, I'm not 65 yet, and I haven't taken it because I'm still working.
Okay. Yeah, but I would start doing the research on that CHAMP. I know enough to be dangerous. I do have in my group a couple vets that really know that in and out. And when I hear the word CHAMP, I know that's when I just leave them alone. Okay? Thank you. Make sure everybody has my card. I'm here. If you want a little more personal questions, I would just tell you, let's make an appointment. I'm a no obligation guy. I just try to guide everybody in the best way they can.
You said you were going to talk about like elder care and stuff. You got, as I see, 22 slides. You got 6 more slides.
Oh, I do.
Are you done?
I don't know what. That's probably more towards the home health care group. I have pre-existing. We kind of touched on that. Supplements are underwritten. Advantage plans are not. Initially going in a supplement, no health questions, you're in. Next slide. Here, observation, I touched on that. Cancer drugs, I touched on that. Touched on home health care. Those are 3 things that really are not covered by Medicare or Advantage plans or things of that nature. They will cover prescriptions, but you start getting on these $10,000 a month drugs and you're going to need some help. So I do cancer plans, $5,000, $10,000, $15,000. You get cancer, I give you a check. Okay? But you can't already have cancer. Right here. I mean, that's what, the biggest thing everybody deals with is they work all your life and you have a health condition and you're in debt. You're even if that's where those cancer plans, some of that home health care stuff comes into play. Go ahead. This kind of gets into the drug part of it. The donut hole. Basically, a plan can have a 0 deductible or a $415 deductible. Then you got your co-pays. Once you spend about $1,200 out of your pocket, you hit the infamous donut hole. When you're in the donut hole, that's when you pay a percentage. What is it now? About 35% of the cost of the drug. And then you come out after you spend about $5,000. Then you're in the catastrophic, where your plan, now your drugs are $3.30, $8, or 5%. So that's where that client, $10,000 drug, is paying $500, 5% paying $500 for that. The donut hole, this is about the only thing, the Affordable Care Act, aka Obamacare, it's slowly shrinking. I don't know if it's supposed to be completely gone by 2020, but it is shrinking, the donut hole. And whoever came up with this in Congress in 2006 should have been shot back then. But anyway, so that kind of gives you the lay of the land. Everybody knows people that, has cancer. I mean, bottom line is, cancer is a killer. I mean, it's just, I got a sister right now dealing with it. But I just can't stress it enough. My goal is to protect family, fortune. That's really what I do. I try to protect you as best I can. I have several retirement planners that use me as a referral for their clients. I'm not a retirement planner. I don't do the financial end of it. But there are certain things you should get in place. Again, living trust, wills, things of that nature. Do some research on it. Those are all things that are very important. And power of attorney is very important to have. Not necessarily just in medical, it's no problem. Send in a form to the insurance company, somebody can speak for you. But when it comes time to answer the question, here's a crazy story. Everybody in a hurry? Okay, the young lady I see, her estranged sister-in-law lives in Chicago, Lakeshore Drive, high-rise. Probably about 7 weeks ago, her son, who is the medical for his aunt, gets a call. She's in emergency room at Rush Memorial in Chicago. Well, we come to find out, a gentleman, he ends up being gay. He's in a different high-rise a block away. Periscope or whatever, sees Lois laying down on the living room floor. Looks again, a day later, she's still on the floor. She stopped taking her meds, went into toxic shock. Bottom line is, you never know. And she has no power of attorney, the emergency room, you do have a do not resuscitate. Thank you. So that's where it's important. And we're not getting any younger. It's always important. And I met with a guy right now that I'm getting all this in place. And maybe I can give him some referrals once I really see how he works at it and what he charges me. But to get those things in place, because you want to do it while your marbles are working. You don't want to. I want to make sure I'm going to make sure I have enough money so we can all have some Irish whiskey over my body and sing a little Jimmy Buffett or something. There we go. Go to the next one, Dave. See if there's anything else there. Heart attack, stroke, cancer. Go ahead. Those are just, everybody knows that. Talks about costs. Hospital, home care, these are all, costs have gone up. And again, this is all part of retirement planning, so you don't use all your funds. Go to the next one. I have very little. I have enough life insurance to bury me and buy some whiskey. Go ahead. Go like that. Yeah, again, these are all pretty well set up for, dental. Really not a lot of dental in straight supplements. I'm kind of an anti-dental insurance guy. Most of it, you're going to pay $40, $50 a month, give you two exams, an x-ray, and some cleanings. Do anything major, you got to pay into it for a year until they start doing major stuff, and then they're only going to cover $1,200, $1,500. Dental insurance is not, I just don't think it's worth it. Move on. But if you really want it, I have it. I don't sell it. I don't do a lot of vision anymore. More and more of these companies, free eye exam, 2 glasses. sitting at you're sitting on it, or you have this. This is a little reply card. If you don't want to talk to me right now this very minute, I didn't put a stamp on it. You got to do it yourself. Just put in your information, and I would contact you. The biggest thing is your name, and give me a phone number that works. I get these back, you know, or I get, I won't even say some of the names that have been put on these. So, thank you.
Thanks again, Steve. Okay, Pam.